Clinical supervision is a vital aspect of professional development in mental health, and this episode aligns with the 15 CEU's Clinical Supervision Training course by Therapy Trainings. We will discuss key concepts from the course and offer additional insights to deepen your understanding of effective supervision practices. Whether you're aiming to refine your supervisory skills or keep up with best practices, this episode provides valuable information to support your growth and effectiveness as a supervisor. Let's kick things off by discussing the ethical and legal responsibilities that clinical supervisors must navigate, especially in Kentucky. As a supervisor, you have a crucial role in ensuring that your supervisees understand and adhere to the ethical standards set forth by our profession. This includes not only compliance with local regulations, but also an ongoing commitment to ethical practice. One of the most important aspects of supervision is the ability to model ethical behavior. Have you ever thought about how your actions speak louder than words? Supervisors are often seen as role models, and your approach to ethical dilemmas becomes a teaching moment for your supervisees. For example, if you're faced with a situation where a client's confidentiality is at risk, how you handle that can set a powerful example. It's vital to promote an open dialogue about ethical concerns, encouraging your supervisees to voice their worries and questions. Now let's transition to the different models and theories of clinical supervision that were covered in the course. Understanding these frameworks is essential for effective supervision. A few prominent models include the developmental model, the integrative model, and the reflective model. Each of these provides a different lens through which to view the supervisory relationship. For instance, the developmental model posits that supervisees progress through stages of development, much like how clients progress through their therapy. As a supervisor, you can adapt your style to meet the needs of your supervisees, offering more guidance as they are starting out and gradually giving them more autonomy as they gain experience. On the other hand, the integrative model encourages you to blend different approaches based on the needs of the supervisee and the context of the work. This flexibility can be incredibly beneficial, as it allows you to tailor your supervisory style to the unique challenges each supervisee faces. And let's not forget about the reflective model, which emphasizes the importance of self-awareness and reflection in supervision. Encouraging your supervisees to reflect on their experiences can foster deeper learning and professional growth. Have you considered how reflection plays a role in your own practice? It's an integral part of developing as a clinician and a supervisor. Next, we'll delve into the essential supervisory skills that you'll need to cultivate. Effective communication is at the heart of successful supervision. Think about it. How often do we misinterpret messages or fail to convey our intentions clearly? As a supervisor, honing your communication skills will allow you to provide constructive feedback and evaluations that your supervisees can truly benefit from. When giving feedback, it's helpful to be specific and focused. Instead of saying something vague like, "You need to do better," try providing clear examples of what that might look like. For instance, you could say, "I noticed that during your last session, you struggled to maintain eye contact. Let's role-play how you might improve that in the future." This not only helps your supervisee understand what to work on, but also offers them a pathway to improvement. Now, while communication is key, we also need to address the often overlooked topic of countertransference in clinical supervision. Countertransference can arise when a supervisor's emotional responses to a supervisee or their clients influence the supervisory relationship. Recognizing and managing these feelings is essential. Imagine you have a supervisee who is dealing with a client that reminds you of someone from your past. It's easy to let those feelings seep into your supervision. The challenge is to separate your experiences from your supervisee's work. A great way to manage countertransference is to engage in supervision of your own. Seeking out peer support or individual supervision can help you process these feelings, allowing you to return to your supervisee with a clearer perspective. As we move forward, let's talk about the role of technology in clinical supervision. In today's digital age, we have access to a plethora of tools that can enhance our supervision practices, From telesupervision platforms to collaborative tools that allow for real-time feedback, technology can bridge gaps and create opportunities for connection. However, with these tools come responsibilities. It's crucial to maintain confidentiality, ensure secure communications, and follow ethical guidelines when using technology in supervision. Are you currently using any technological tools in your supervision practice? If not, it might be worth exploring how you can integrate these resources into your work. Cultural competency is another significant aspect of clinical supervision that cannot be overlooked. The course emphasizes how understanding cultural differences can enhance your supervision practice. As a supervisor, you need to be aware of how cultural backgrounds can impact your supervisees' experiences and the therapeutic relationships they create with their clients. Consider this. If a supervisee comes from a different cultural background than you, their approach to therapy may differ significantly. This isn't just about being aware of differences. It's about actively seeking to understand and incorporate these perspectives into your supervision. Encourage open discussions about cultural influences and consider how your own biases may shape your supervisory style. Let's now touch on the importance of developing a supervisory style that is both supportive and challenging. It can be a balancing act, right? You want to create an environment where your supervisees feel safe to explore their thoughts and feelings while also pushing them to grow and improve. One way to achieve this balance is through the use of supportive feedback. When you provide constructive criticism, frame it within a context of encouragement. For example, you might say, "I really appreciate how you handled that client's concerns, but I think we can work together to find ways to engage more deeply in future sessions." This approach not only validates their efforts, but also encourages growth. As we wrap up our exploration of the course material, let's discuss the various roles and responsibilities of a clinical supervisor in Kentucky. You wear many hats: mentor, educator, evaluator, and sometimes even coach. Each of these roles comes with its own set of expectations. It's vital to understand the boundaries of your role. While you're there to support and guide your supervisees, you're also responsible for evaluating their readiness to practice independently. This evaluation should be ongoing and based on clear criteria that you establish together at the outset of the supervisory relationship. Now, let's address some common misconceptions about clinical supervision. One prevailing myth is that supervision is merely a form of oversight. In reality, effective supervision is a collaborative relationship that fosters learning and growth. Another misconception is that feedback should only be given when something goes wrong. In truth, providing regular positive feedback is just as important as addressing areas for improvement. So, how do we tackle these misconceptions? Start by setting clear expectations with your supervisees about the purpose of supervision. Emphasize that you are there to support their learning journey, not just to critique their work. Before we conclude, let's take a moment to reflect on the importance of ongoing professional development. The field of mental health is constantly evolving, and as supervisors, we must stay informed about new theories, practices, and ethical guidelines. Therapy Trainings offers a variety of courses to help you continue your education. I encourage you to explore their website at therapytrainings.com to find courses that align with your interests and professional goals. As we wrap up today's episode, I hope you've gained some valuable insights into the world of clinical supervision. Remember, effective supervision is about collaboration, communication, and continuous growth. By embracing these principles, you can foster a positive and productive supervisory relationship that benefits both you and your supervisees. Thank you for tuning in today. I encourage you to take what you've learned and apply it in your practice. Don't forget to check out therapytrainings.com for more courses and resources to support your journey as a mental health professional. Until next time, keep striving for excellence in your practice and take care of yourselves and your clients.